Hi, in this video I'm going to be talking about breast cancer in older people, sometimes called elderly people, and generally we use the cutoff of 70 years of age to describe somebody as older. One of the most common risk factors for breast cancer is getting older. That's the case for most cancers in general. As we get older, we're exposed to more things and there's more opportunity for damage in the genetic material in the cells, and also our bodies are less capable of repairing that DNA damage. We also seem to be a little less resilient to immune threats, so it's easier for us to get infections over time. And breast cancer, if there's any immune surveillance where the body's own immune system fights the cancer, that tends to get a little bit worn down. Surprisingly, breast cancer in older people tends to be less aggressive or active than breast cancer in younger people. So we'll see more estrogen receptor positive tumors, for example. If you want to learn more about that and what that means, we have another video that we'll put below so you can learn more about the estrogen receptors. Basically, though, what we know is that older people should be treated the same way as younger people as long as their general health is good. So preserving the breast, not running right away to a mastectomy. If somebody does need to have the whole breast removed, that is a mastectomy, they can be considered for breast reconstruction. And there's lots of evidence that older people like to have a breast mount after their surgery. There should be no discrimination just because we're getting older. In terms of radiation therapy, some people who are older with small tumors and very wide margins may be able to avoid radiation therapy. This is a very select group of people, so talk with your doctor if you're interested in avoiding radiation therapy. In terms of chemotherapy and endocrine or hormonal therapy, we make decisions based on somebody's life expectancy. So recall, in early stage breast cancer, we're treating people with chemotherapy, that's stages 1, 2, or 3, to hope to prevent a recurrence down the road. If somebody has a very short life expectancy because they have heart disease, they've had multiple strokes, they have very bad diabetes, or they have other health problems, we're not looking at such the long term, we're looking at quality of life in the shorter term. But in general, there's really no upper age cutoff for which somebody can't get chemotherapy if it's the right thing for them. Endocrine therapy, which is anti-estrogen therapy basically, can be given to older people as well. If somebody's not as mobile, they're sitting down more, there are more risks of blood clots with tamoxifen. For example, the aromatase inhibitors are associated with a decrease in bone mineral density. So if somebody's older and they already have thinner bones, that's something we keep a real close eye on, is bone health. Basically, there's nothing about your chronological age that says you should be treated differently than somebody who's younger. As with anybody, your preferences and the information you get will help you make a decision about what types of treatment are right for you. I've covered a lot, why we see breast cancer more as we get older, how to treat breast cancer in terms of surgery, radiation therapy, chemotherapy, and endocrine therapy. We've talked a little bit about other, what we call competing causes of mortality. So if somebody has a short life expectancy because of other medical conditions, that does factor in. If you are older or one of your loved ones is older and going through breast cancer, these are the kinds of things to keep in mind. If this video has been helpful, click like and subscribe so other people just like you can find it.